wanted to open up by just acknowledging the date, that this is 9/11, and I know we all remember what happened 14 years ago. I think probably all of us still remember where we were. I sure do. And it's kind of interesting where I was on that day. I was actually working on the Hill for Senator Kennedy, and we were going to have a hearing, the first hearing on early childhood under in that Congress. And our witness was Laura Bush. And I remember when the plane hit, we were getting ready to go in, and she was coming down the hall, and all of a sudden, chaos broke loose, and everybody scrambling to get her out of there, and we canceled the hearing, etc. But it does remind me also of just how far we've come in the 14 years since that date. In early childhood, because we were working on reauthorization of CCDBG in 2001. It took us until 2014 to get it done, but we did get it done. But there's been a lot of things that have happened in the interim time since then. And so I think it's important that we remember history and how important it does take. And I think, Phyllis, what you said was absolutely correct, that change is incremental. It takes time. It takes knowing where you're going and persistence in getting there. And I think as a field, we have finally gotten there. And I think that really is true. Then I wanted to say also that if you think about it, I was thinking to myself also, what a difference a year makes. Because I did speak to this group, I think, last year, and I was thinking back about how much has changed since we met a year ago. And this is just the high-level stuff. We did pass CCDBG. We have now issued new Head Start performance standards for comment. We have a new Head Start framework for child development. We passed the Caring for Our Children Basics health and safety standards. We've taken on the issue of expulsion and the social emotional development of children. We have stood up 275 early Head Start child care partnerships. We reauthorized the home visiting program, and the list goes on. So we have made a lot of progress in the last year, and I think congratulations to everyone in this room and around the country who helped get that stuff done. So I want to talk just briefly. I know what you want me to talk about, and I will get there, so don't fear. I will get there about the CCDF plan. But I do want to talk big picture a little bit in terms of what are our goals. We have about 14 months left in this administration, and so we're very aware of the clicking or the ticking clock here. So what we really want to get done, and I have basically 4 top goals for the remaining time. One is implementation of CCDBG. And just to update you, we will be issuing a new draft regulation. We hope by December. It is done, and it is moving through the coordination process right now within the department and should go to OMB this month. So that means they have a certain amount of time, we'll get out. But anyway, the process is long, and no one in their right mind would have ever said that they would take on doing a reg in a year. Usually regulations at the federal level take 2 or 3 years to get done. But we have a lot of help, and people want to get it done. That we want to get CCDBG implemented before we leave office, so that's a high priority. The second one is finishing up the Head Start performance standards. How many of you have read them in here? I think all of you should read them. They're very important to us in that we are very much trying to align Head Start and child care, and you should really see in those standards where we are making those efforts. The next one is full implementation of the early Head Start child care partnerships. We are very much watching the progress in the partnerships. I think we were close in August. We're counting by the month. We stood the partnerships up around April of this year, and we already had close to 9,000 children enrolled in August. We are anticipating getting close to 30,000, so we're very excited about that. I think we're on a really good track on it. And then the last thing that is really important to us is if you all remember back to the President's budget and the State of the Union message, when the President announced a major initiative to fund childcare. And I've said in the department, this is why I came here, so this one is really important to me. So you will probably see, and this is kind of a little heads up, with this month sometime, our vision of what the $82.6 billion budget request is all about. We have been working for, I know it seems like, well, what happened? It dropped off the face of the earth. Well, nothing in government happens fast, we know that. But we've been working on what would it look like when we introduce something to support the $82 billion, and we have that now. We've got coordination with OMB and the White House on it, and we have 2 members of Congress, one in the Senate, one in the House, that we think are going to introduce a bill to go for this. Now, these things kind of come full circle because one of the things you want me to talk about is the workforce issues, and I know one of the issues around workforce has to do with pay. We have been very concerned for a long time about how we deal with the pay issue. Some of you have heard me talk about this before, and I say always, I get very frustrated. I love Marcy Whitebook, everybody knows that, but I get very frustrated on the Worthy Wage campaign because for me, it's always been until we can tell people how we're going to get money into the pockets of the people out there, we can't solve the problem. Because you can give somebody a little wage incentive that they get once a year, but it's not sustainable wages, and we've got to figure it out when you've got family child care, faith-based care, center-based care, private, nonprofit, for-profit. How do we do this? So our vision for the $82 billion is the best, and I will tell you, it's the best that we can come up with, of how we are going to finance child care. And what it amounts to is through the voucher system, because whether we like vouchers or not, that's what we have. And I'm nothing if not a realist, and I really do understand that, you know, in order to fix this, we got to fix the voucher system. So our vision is then to essentially double the average subsidy in this country, and that's what the $82 billion is. That will drive a lot of money into the early childhood field, and it should increase the allow us to deal with the wage issue. So if you understand where we are, and these are averages, guys, okay, but on average in the country, we spend about $5,500 for an infant space. That's the value of a voucher on average, and that we all know is not enough. You have to draw the lines connect the dots for people. And when you then say, okay, the average person takes care of 4 infants, you do 4 infants times $5,500, and what do you get? $22,000 a year. What is that in this country? It's exactly poverty. And so when people begin to understand that through our voucher system, we are putting our workforce into poverty, they start to think about it differently. And that's exactly what we're doing. And so what our goal is, if you take and you double that amount to $11,000, now you do the times 4, and what do you have? You have a living wage. So that's the thinking behind what we're doing. Now, understanding that these are averages, and in some places it's going to be higher, in some places, you know, maybe not so much. But the theory behind what we're trying to do is exactly that. So what we will be introducing will be legislation that is going to require the states to come in, apply for the money, agree to do these things, and if they agree to do them, they get the money. But we're not going to just put more money out in a block grant with no accountability and no ability to deal with this issue. So I hope when you see this all roll out, you will think about it very carefully. I think we're also painfully aware that people have been asked to do a lot in terms of working with Congress, doing different things on the advocacy front, but keeping in mind that this is a big deal for child care, and that we're going to obviously need some lift on this. Now, one of the things that I've said in working with people on the Hill, it's also scalable. So in the first year, you know, I think what we put in the budget, and by the way, it's paid for in our budget. When people ask what's the pay for, if they were to adopt HHS's budget, it's in the budget and it's balanced. But they don't see it that way. So just so you understand, they'll see it as something else that we have to come up with a pay for. But in any event, it is scalable. So if we didn't get the full amount, we still could begin the process. In fact, if we got the full amount, I don't think we could do anything with it. I'd be a deer in headlights on that. So it's scalable, and we think that not in terms of the amount of the subsidy, but the number of states that would probably come in for the money anyway. It would take time. So anyway, that's what you can expect. It's a vision in many ways. It's a vision for how we finance childcare. And it's the best that we could come up with. So now back to the workforce issues, because they all sort of relate. And when I know that you've had folks here talking about the workforce study, I hope you've all read it. If you haven't read it, shame on you. It's the biggest thing in the workforce in my lifetime, in terms of finally defining for the field what we need to do, where we need to go, and essentially, in many ways, how to get there. Now, the big question has always been, well, but it doesn't say anything about pay. And I will say straight out that we actually asked the national academies not to deal with the financing, because it would take them off course and we wouldn't get the answer that we needed on what is it that the workforce needs to know and be able to do in order to meet the needs of our children. So we specifically said, don't do financing, and they didn't. They respected the ask. That said, we know we need to do that. Now, I've said at ACF, and probably anyone in this room could do it too. I'm not trying to act smug here, but I could sit down and write a report on how to do financing. But no one would believe me. We need somebody just like the workforce study to tell us that we need public financing for this. And so we are in the process. We've written up the description, and we will be starting the follow-on National Academy of Sciences study on workforce, or on financing. It's going to be on the fast track. We're hoping to get it done in a year. It won't be done probably before we leave, but it should be done in time for the next administration to really begin to examine this issue. We need a combination of public and parent funding. Parents can't pay the whole bill. We're not suggesting, though, that they don't pay anything. But we are suggesting that in order to get where we need to fix the financing. So the study will be done, and it was intentional that we do it this way. And I know sometimes that's frustrating to people out there, because you read the report and you say, okay, that's fine, but if we can't pay them, they're not going to do this. And we know that, so we're working on it. So where does that leave us then? In terms of the workforce, and where it leaves us, guys, is getting ready for the financing piece, and they have to happen hand in hand. You cannot be saying we're going to pay people more and then expect nothing for it. That just doesn't fly anywhere anymore. So we really have got to figure out, where are we going with this workforce issue? How are we going to get to the goals laid out in the NAS study? And what's the pathway for people to get there? And how do we begin to increase the pay as we get them there? So I think that's one of the things that I want to talk about a little bit more. Before I do that, I do want to go back and just tell you a little bit about what is going on in Congress. And I think it's interesting. We all know there's chaos in the budget right now, and whether we get a CR, a continuing resolution, and all those things, which probably you all glaze over when people say. They are important, though, and we do have some serious budget issues. But that said, Congress is extremely interested in early childhood. And I say, you know, when people talk about HHS's budget, there are two things in all of the Department of Health and Human Services budget that got an increase in both the House and the Senate appropriations bills this year. One was early childhood, and the other one was the National Institutes of Health. Everything else either got cut or was level funded. Two things, and if you don't think this is a big organization, think again, because we have Medicaid and Medicare and CHIP, and we have everything that, you know, in HHS, and two things Congress supported. And the two things, one of them was the partnerships, the early Head Start Child Care partnerships, and we are already planning for another round of partnerships when and if we get the budget straightened out. So we will be funding more of those. Why? I think because we can show accountability, and Congress wants quality, but they also want accountability. And so with this money, we can say, you know, how many kids, what the quality is that these kids are getting, and so there's something that they can hang their hat on. So in summation with Congress, early childhood is probably one of the very few areas where there's still bipartisan support. CCDBG was bipartisan, and there still is support on this issue in both sides on the Hill. So I think that those should be factored in, and your conversations that you have when you have access should support Congress in terms of this issue, that they've been very good, and it's been both sides. The one thing that Congress is concerned about, and I will tell you that we're doing a report on the duplication and overlap in early childhood. And in some sectors, there's a belief that we're duplicating programs. Well, we know that that's not true, and so we are doing a report back. But the belief is there, and so I would caution everyone in this room, and I do the same with Head Start, is do not suggest that there is overlap. There really isn't overlap. A child is not being paid for by both Head Start and child care at the same time. Sometimes there's wraparound child care to Head Start, but that's a different thing. And so Congress has it in their mind that for some reason kids are getting the same services from multiple programs. What they're getting is services layered on because we don't have enough money to do what we need to do for all children. So sometimes we layer on different things onto child care or onto Head Start. So I want people to understand that and be clear when you talk to folks about that, because it is a continuing issue. And we were just informed that we're going to have a GAO study of this now too. So they're very serious about wanting to figure it out. Okay, so now let's get on to the workforce and what are we going to do from here? And I did, the question that I was asked is, how can the registries play in the issues on the CCDF plan? And how can you participate in it? What's your role? Before I go there, because I did go through, I have the plan with me, and we're about ready to publish the next version, probably in a couple of weeks. It's been out for comment once, as you know. We'll have the next version out soon here. But what I wanted to do before I say what are the get into the nitty gritty, because I went through it and I really looked at it for you guys and where do you play in it. I want to challenge you to think about generally in what you do in the registries. What's your bigger role? And I think that now, for the next probably decade, the workforce is going to be the single biggest issue that we have. How do we pay for it? How do we improve it? How do we get the things in place that we need? The higher ed systems, how do we make them work, et cetera? I know that you heard from Albert and you've heard from people on what's in the study. They make the case for all of these things to happen. But I just think that you all need to figure out what your role is in all of this. And if you just see yourselves as plugging into things like this, is that really what you want your role to be? And I don't know the answer to these things, but I do think it's time for all of us to ask. And my question is, who owns the workforce issue in this country? In your communities, in your states, wherever, where does it rest? And again, I don't know the answer to this. In some states, it's clearer than others. In some states, there's been workforce systems development things going on. I know that in Illinois, that's one state that's done a lot of work on it. And I'm sure there are many more. But I'm just questioning as a matter of interest in thinking forward for 10 years, how are we going to coalesce around this issue of the workforce, and where is it going to rest? And I think it's an issue that we need to straighten out, because there are things that are going to depend, are going to make a difference, and they're really important that we figure this stuff out. So, for example, in a community or a state, who's really doing needs assessments on the workforce in a consistent manner in which it can inform sort of the work that we're talking about? When I say needs assessment, you guys have data on some of this. How many people at what level of this field do we have where? And before you can really come up with a plan for where we're going to go with the workforce, you really need to know where you are. And I'm just, maybe some of you know this, and in the conversation afterwards you can help me understand if you do. But I'm going to tell you that I think across the board in states we are lacking this information. We think we have a lot of information, and we learned a lot. The National Survey of Early Care and Education was very informative for those of you who didn't really pay attention to it. We learned that our workforce turnover rate is not nearly what we thought it was. That's a good thing. People sort of grimaced at that and said, oh my God. No, that's good, because the question of is it worth investing in the workforce? Yes, because they are staying. They do like the work. So, but in your communities, is that true, not true? Are they turning over within the field? Are they leaving the field? All of these things are going to need to get sorted out in the next decade as we begin to invest in this, in the workforce. And so where are we going on that? And then once we know that, then what are your goals? And again, registries should be the people, in my opinion, helping set those goals within a state. Because you have all this information and you also understand the workforce probably better than most people do. So again, I challenge you to think about your role in your state within this whole area and try and figure out, can you be a leader? If not a leader, how do you get, are you at the table? Who's doing the different things that need to get done? And I just think, do you want to own this issue or not? And if not, then who? And I don't know. So again, a question that I would just say you need to think about. So, okay, so going then on into the state plan. And there is so many places in the state plan. If you've read the CCDBG law, you know that. I mean, the law is pretty clear on what's required in terms of the workforce and the professional development. So at every level of this, the state administrators, do we have any state administrators in here? State administrators, okay. State administrators, I'm not going to try and speak for you, but you can tell me if I'm wrong, need your help. I think that, they have got a full load on their plates right now in terms of getting these plans done and implementing this law. They need help on some of these things, at what's required in the state plan. And I think specifically, hopefully you all understand some of the issues around professional development, what counts, what doesn't count. We have got to define all of these terms. They need to have a lot more information on what's involved in professional development. What is TA? What is training? What is coaching? What is mentoring? How are we counting these things? How are we planning for them? Mentoring, apprenticeships, College coursework, who's tracking it, how much is there, is what is in the state good? I mean, is it meeting the needs of the workforce? What about cultural competence? Is anybody looking at that issue? It's huge. It's a big deal for this country right now. The diversity issue. We do need to be focusing on the diversity of this workforce. It's vitally important. Dual language learners. How are we dealing with dual language learners? And that is an increasingly large population in our early childhood communities. Disabilities. How are we training folks to work with children with disabilities? We say kind of, well, not so jokingly, is that if anybody were to really challenge most of the child care community around the disabilities issues, we would all be in court, because I don't think we're actually doing and accommodating in the way that is intended by law children with disabilities. So we got a lot of work to do on that. A new area, are you all tracking, and how do you define business practices? There's a special place in there, and this is an important issue for us. Business practices of early childhood really needs a lot of work. I think we'd all say that. And it is the reason that we lose a lot of really good people, because we just are not doing what we need to. So the business practices. Then the whole issue of credentials, certification, and degrees. And are you tracking all of those? And if you are, how do you know what you are tracking is good? And I know that there are states that have Florida is one of them that has multiple credentials. What do those credentials mean to people? And I think those are serious questions. So I think another thing in terms of this, the whole issue with the preprint is aligning these things with your state early learning guidelines. That's something that state administrators now have to certify to, that these things are aligned. Are they? Do you all know? I mean, these are just questions I'm asking, because I actually don't know the answer to them. If the registries have that information, understand that, know that. What about, one of the goals is the stability of the workforce. As I was saying earlier, the turnover. Do you have data that can help your state administrators understand the stability of the workforce? And if you do, how are you sharing that? Because again, these are specific things that are in the new law. Are you working with state advisory councils or on them? How many are on your state advisory council in here? You all should be. And hopefully you all have one. Because they are still in the Head Start law. And then I think the last one that I would say, and it gets to what's in the IOM study, is we will be looking in the plan for some of the issues around these specialized competencies. And I do think that when we say the specialized competencies, are we tracking directors? The leadership, as the IOM study terms them leaders. Do you have them in your registries? If not, we need to get them in there. And then we need to understand what they need as well as the teachers. And I think I'm a person for a very long time who has believed that the leadership is key to everything that happens in a program. And I've said, it's just like a school. If you've got a bad principal, you got bad teachers. If you have a good principal, you got good teachers. And the same is true in childcare. If you've got a good director, generally speaking, you've got good staff, because people don't work for people that, that are not, the good people don't stay in places with bad leadership. So we need to figure these things out. And I would tell you that in my view, and I have been coming to this meeting and I've talked to you all for many years, I would just put this in your lap. Because I think these things are things that if you aren't already doing them, then you need to be thinking about them, because, as I said earlier, if not you, then who? And I don't know the answer to that. And so if we want to carve out a place in our communities for ownership of these issues, then I think it's up to you as leaders to do that. Okay, so before I close, I just want to spend just a little bit of time talking about a couple of the other things that are priorities for us in the closing time in the administration, and ask possibly at some point, for those of you who come from or have thoughts on this, to contact me about them, because the areas that we're getting very serious about are some of the issues around the rural communities and the rural states. And how do we support them in all of this? And the challenges of the workforce in rural America are enormous. Some of you have heard me say I come from a rural state, and I lived in a community about 130 miles from a doctor for about 5 years, so I get rural. And I know that I was probably the only person with a degree in anything related to early childhood for probably those 130 miles. So it isn't so easy to just say we're going to pay more and we're going to get more. We have to figure out how we're going to build that workforce. That leads me to Early Education Central. Have all of you been on that and looked at it? That is one of our efforts to help in the rural area. And how do we get that out there in a way that's affordable and there's access to it? And so you can tell us what else you need on that. One of the things that we are examining, were any of you on the webinar that we did a while back? We did go through some, thank you, and we did talk about this. I think we're looking now at bundling of courses for states. So in states that have certain requirements for entry-level training of the workforce, I think we're going to start trying to figure out how we can work with those states to bundle courses in a way that answers that state's needs, so that they're all in one place, so Iowa or Ohio could come in and here it is. So that's one of the things we're doing. The other thing that we've been working on that's important, and we're starting now to take to the next level, is what I still call Head Start University. And for those of you who haven't seen it, I hope along the way you do. We have developed core courses for a bachelor's degree with the University of Washington, and it was paid for with Head Start funds. And they are available both online and through on-site, but we are working right now with 15 states who are thinking of adopting those courses for a bachelor's degree program in their states. We signed the first ever MOU between the University of Washington and the Salish Kootenai College a couple of weeks ago to get them into tribal communities, and that is in a rural area. So again, it's an effort to get something out there that is solidly, high quality, and if you have an opportunity to see them, I suggest that you do. And try and deal with the higher ed issues. And you know that the higher ed issues are big in the country. I've ranted and raved about that over time. So the Head Start University is moving forward, and we are moving now into how do we get these courses into more states to answer the need for high quality early childhood bachelor's degrees. And then the final one, I think I talked to you about this last year, we are continuing the work on the credentialing and looking at how we would create what we call nationally recognized state credentials, so that we can create a back and forth so that these credentials go back and forth between states. We've narrowed our focus on this to birth to 4, to the infant toddler area, because we've realized that that's really where the worst hurt is, so we've narrowed the scope of what we're trying to do, and hopefully you will see something coming out yet probably next year in springtime sometime on that. So those are big, and we're still working on them. The next thing that is huge for the field, I think, we are probably about maybe 2 weeks away from announcing the new training and technical assistance design. As many of you know, for the last year or better, we've been working on how can we create one training and technical assistance center for all of early childhood. Instead of having Head Starts over here and child care over here, we've put all the money together, and we are looking at one training and TA system for the country. So rather than have a health center in Head Start and a health center in child care, we've got one. Now, what does that mean to you all in early childhood, and in particular in child care? Well, if you go to the Head Start website and you look at everything that's on the Head Start website that's been designed for the Head Start program, it's going to be available to child care, and vice versa. So that we're going to have to do some things we know that there'll be some adapting of materials. Our second goal with this work is to make sure that we figure out the delivery system and how do we get materials to the lowest level. Now I'm going to say something, and our state administrator back there, don't get mad at me, but we do know that in childcare, for example, we send a lot of stuff to the state administrators, and we know that they're swamped. They've got way too many things on their plate, and a lot of stuff just stays there. It never gets beyond there. So what we're trying to do is figure out, in working with our state administrators and our state teams, how do we get this stuff down to the lowest level? What is our delivery mechanism out there in our states to make this stuff get to the people who do the work? So that's a big goal of the TA redesign. We are really looking and hoping that we can ultimately get infant toddler specialists universally around this country, that we can get social emotional consultation available universally around this country. So how do we begin to build that kind of structure at the lowest level? So when we develop things at the federal level, we can't deliver them, folks. Somebody's got to do that. That they get out to the people who need them. The other thing that you're going to see in conjunction with the training in TA is we are issuing, I think this one is big, personally. We know that the expulsion issue, the social emotional issues, the challenging behaviors issue, if I go anywhere, I hear it. What's the biggest thing people need? They need help with it. And then obviously kicking kids out of preschool because they can't be managed. And that's a sin in my mind that we don't do better. So we have been working with SAMHSA, who's our mental health arm within HHS. And we will be announcing, might be next week actually, a new mental health TA center for social emotional development of preschool age children, with a complete, absolute zeroing in on this issue of the need for mental health consultation out in the states and social emotional development and support for our workforce. So that's in conjunction with SAMHSA and ACF, and we're really excited about it because it is so long overdue. So that is in the offing and very, very close. I'm trying to look at my list of things and cut it out because I want to have time to take questions here. Two other things that you need to know are happening, just so you can be watching. We are doing 2 other studies with the National Academy of Sciences, one on dual language learners, and that's in process, and we should have some report back sometime in the next year. And we're also doing a parenting review with the National Academy of Sciences. In the interim, what you can expect from us in the next probably 3 or 4 months is we have been looking at parenting programs, and on a continuum from just families who need just a little bit of parent education to families that need a lot. And what we haven't done yet from our level is help people understand what works for whom, the intensity, some of those types of things. So we've spent a lot of time over the last year working with the Centers for Disease Control, SAMHSA, a number of agencies within the department, and we'll be putting out a parenting continuum which shows what parenting programs have evidence that they work, because I think there's a lot of junk science out there right now, junk stuff on the, for parents, and it's confusing. So what parenting programs work for what population of people, what's the cost, and so forth. And you should see that coming out probably by the end of the year. We'll get that out so that people can have help picking programs to meet the needs of their parents and their programs. So I think with that, I'm going to stop and take questions because I think I could ramble on a while here, but I think that's probably enough. So questions, comments, anything? Did I say something that offended anybody? I'm sorry if I did. I usually say something bad. Yeah.
I'm Erin from Iowa. I was just wondering, do you see in the future a requirement of programs to use registry systems so that there would be an ability for you to have data that you wanted for workforce?
In the near future, probably not. I see, more data coming, there's just a requirement for more data across the board. Federally, probably not. But it's certainly what we're asking for the states and the state plans to tell us is stepping it up a lot. And so your data is going to really matter, but your data matters in a bigger thing than just what, we're requiring. I think it matters in influencing how these workforce development systems, get expanded to all people. And I didn't say that, but I mean, we need to make sure that we have everyone in there. And, and that just is, that's the wave of the future. So I think I don't, I don't see much more. We are interested in, that said though, we are interested in data sharing systems. And I think that one of the things states are going to have to figure out is how they share data and how they develop their systems. Not, that everybody needs to go out and build a new one, but just how do you figure out how to share the data back and forth? And that's a challenge. And we have actually, and some of you know Jay Albright, who is on the board here, we've hired him, I'm sorry folks, but he's now working at the Office of Child Care. And part of his job for us is to figure out this technology data issue, because I will tell you that is not a strength of most people that are, it just isn't. So his challenge is that. And how do we figure out how to help states with technology, with data sharing, with sort of all of the pieces of this puzzle? So, yeah, that's a big one.
I'm wondering if there's any connection with Department of Labor and workforce issues.
That's a really good question, and we've had a couple meetings with the Department of Labor on implementation of WIOA, and they're just swamped. And so there's a piece in the new WIOA Act, if you're familiar with it, about childcare, and actually about doing a study, which they're looking at right now. So we have actually, in the last couple of weeks, set up meetings with them to talk about what that's going to look like. One of the things that's really interesting to me about the Department of Labor, and it's kind of what goes around comes around. Some of you in this field, some of you in this room will probably know this. About, I'd say maybe 20 years ago, there was a big focus on apprenticeships from the Department of Labor, and there are some states that still actually have apprenticeship programs, but not many. DOL is back now thinking that apprenticeship programs and especially in the healthcare and the early childhood field are the way to go in the future. So you'll probably see more discussion with the Department of Labor on that issue, on apprenticeships. And I do think that there's a lot to be done in that area. And it's on the radar screen. So they've been slammed with getting guidance out. They had very short fuses on some of what they had to turn around. So.
I've talked for a while. I just want to make a comment. I think you've done an amazing job of alignment. I think that I appreciate definitely the focus on infant and toddler, because I think we've done so much work around the early learning challenge grants around preschool that our infant and toddler has been struggling a little bit. So thank you again for the specialists, especially definitely interested in the social emotional early childhood mental health area too. Now we've been struggling with that in the state. One thing I want to suggest to you to highlight too is also doing some work with the individual on that program cost of quality calculator that you guys have all built. I think there's a lot of rich work that's there that I know we are trying to pull in, and definitely for our CCRNRs to work in that business operations area, and that tool is really helpful for that. So thank you.
It's interesting that you bring that up, because that's been, we've talked a lot about that as we're writing the reg. Because if there's a lot of pieces in CCDBG about sort of the how we do this, and they've actually allowed us to do a cost of quality study versus a market rate study. which has been very interesting because we supported it, as you know, in the old reg, and then the field kind of reacted to it, and we were, they were not happy with that idea. But I think if we're ever going to get anywhere, we have to go to cost of quality, not to market rates. So we actually have been looking at that in terms of how we do what we do in the rule around ensuring equal access. Because equal access to what? At 75th percentile of the market rate, I'm not sure what that says. Is 75th, because the market is depressed, we know that. It's drugged down by a number of different things. Unlicensed care is a big one, but there's a number of factors. And so at 75% of that is not anything. So I'm a believer that the cost of quality is where we need to go. Did you? That's good to know.
It was so easy to talk and walk into legislators and show them that. And this percentile, I've never been able to explain to anyone.
No. And you know what's...
Like more than whatever
Well, it's been really interesting because we've been looking at this as part of what we're writing in the new reg, and it's funny because in tracking back how we even got to the 75th percentile, the truth of the matter is somebody picked it out of the air. That really is the truth. And the other piece that is similar to that and is nobody knows other than it just seemed like a good number is, what is affordable to people, 10% of your income. Nobody understands. I mean, there's no science to that at all. And so, between the 75th percentile and 10% of your income, we just have a mess. And so we're looking at those. We're really, really behind the cost of quality, the calculator. And interested in how we move on. And then our challenge, and I'd be interested in people's reaction to this, our challenge is when states set the rates, how do we know that people are getting access? And how do we hold the states accountable for this? And that's a challenge. We have the new law, and I'll get right to you, sir, but the new law gives us a lot more oversight responsibility and the ability to do penalties for, non-compliance, which we're looking at how we would do that. And I think the other thing I need to say, and I say this in all sincerity, one of the things that we know, and we've had these conversations with a couple of state administrators about this. The decisions about where the rates are set are not just state administrators. They're really mostly driven by budget people who do not understand what's going on with so much of this. And so it's all about, this issue of getting more spaces and the budget issues rather than cutting kids. So we're caught in this kind of quagmire. So I really want to talk to you about that. Right. Is that right? That's great. Oh, we I mean, every little thing helps, Todd, let me tell you. You said something else that I want to focus on, and you're probably picking this up from the work that we're doing. Our work over the next, probably, the time remaining is going to focus almost totally on infant toddler. We are very concerned. The alignment issues are big. The partnerships are huge for us, but the lack of high-quality care for infants is just at a crisis state out there, and it's cost issues, and we know that. So most of what we're working on right now, the $82 billion, is up to 4. So the money will go into the birth to 4 space. That's where we're focused. We're looking at the credentialing piece around the birth to 3, 4 age, all of it, because it's just been ignored, and we've got to deal with it. Somebody asked me, I was at a meeting yesterday, and we were talking, the Rural Council was in Washington, and some of us met with them, and this woman was asking about how do we make people understand this issue on the early infant toddler. And I have seen there's a single thing that people can do to change people's attitude on why we need to invest in infant toddler, and that is to get somebody who knows the brain science to talk to people. And I've said this, we had, some of you know Dr. Cool from Washington, University of Washington. I've watched her. Anybody here from Alabama? Alabama is doing, they did a statewide thing, and Pat Cool came, and she was the opening speaker, and went through the neuroscience and the infant toddler issue. And in the room were people from the governor's office, eventually the governor was there, the superintendent of schools, the people in charge of HR, everybody at the state. She gave the opening, and I will tell you, I think it turned around that whole audience. Because once people start to understand the impact that we have or don't have, in those first 3 years, they all of a sudden get it, and it's like the light bulb goes on. So I said to this woman yesterday, she was from a northeastern state, you're close to Harvard, and there are people at Harvard who do this stuff. Go get them in there, have them brief people in your legislature. It'll turn them around. It will. There's nothing else that I can see that does it like having them see the science, not just hear it, but see it with these little babies. And I think it's the strength of the IOM report, because I've read that. I'm somewhat of a geek on these things, and I've actually read the thing several times, but I was rereading the section on the science, and some of it I just kind of go myself, I go, oh my God, it takes a lot of work to understand the epigenetics and all that kind of stuff. But the research is so solid on why we're doing this, and that report really makes the case. So I would say, again, use it. And if you haven't read it, read it. It's hard. Yeah.
You'd say that your big focus is going to be infant toddler. That's great. But one thing that seems like would be a real help would be the current administration is pumping a lot of money into public schools for 4- and 5-year-olds, which is causing community centers to lose 4- and 5-year-olds. Without 4- and 5-year-olds, they can't serve infants and toddlers because economics don't work. So one part of your administration is working kind of against the other part of things.
No, we don't see it that way, Roger. We see, and it's why I think, the $82 billion request, yes, the preschool development grants are doing some of that. But we've always said, and if you haven't heard me explain this before, we've always said that we should be taking the money that we're currently spending federally, because the issue is back to the financing issue. And the fact that we don't have enough money in this system, and that's why we've got to get states to stand up. We will never fund all this from the federal level. So incentivizing states to take on the 4s in the pre-K allows the federal government's funds to move down to the birth to 4. And that's always been our strategy. Now, yes, the first out of the gate was the pre-K. And that was just the way it all happened. But that doesn't take away from the commitment to the partnerships, which is only in the birth 2, 3, and now the $82 billion, which is the last piece of our puzzle. And I know in the short term it seems that way, but in the long term the strategy has always been sort of this balancing and getting states to pick up the cost of the 4s. And incentivizing them to do it. So the federal government, everything that Department of Education is doing are really incentive grants. They're not long-term funding strategies. They're 3-year grants to get states to pick this up and run with it. So I know sometimes it seems like it's short-sighted, and I'm sure at points in time people go, do they really know what they're doing up there? But there is a plan. And that is the plan. So I'm really hopeful that we get the $82 billion ask out there, and that the field gets behind it. That's what has to happen, is the field is going to have to get behind it. So you had a question, and I think or did you? Okay.
You answered, I think, my initial question, but it led me to a different one. And you mentioned earlier about the vouchers and how the states still have to apply for those. So, like many other states, how do we encourage our leaders, our legislature, to apply for those, how to recognize the importance of that? And, maybe it's just a matter of the roles that we are playing and what role is that, who do we talk to?
I'm not sure I understand what you mean by apply for vouchers.
You're talking about each individual state still has to apply for the funding. So how do we encourage our state to apply?
That's a really good question. You get the money for CCDBG, CCDF funds. You just get Wisconsin is getting that money, but any new money, that is a question. Now, you did get raised to the top, I think, in Wisconsin, right? This is the hard one, and we've been asked this question because there are states. There's probably some states in here. That we know the state is just Idaho, Wyoming, South Dakota. Anybody here from those states? Where the state just has said, we're not taking federal money. And, I don't have an answer to that because it is something that the state is going to have to deal with ultimately because, and I understand that people are stuck. But, that's it. We can't just keep putting just more money out there and putting it into a black hole. And that will be the premise on the $82 billion is the state's going to have to apply and they're going to have to agree to do the things that we need to get done. And that is the workforce, the pay, these things. And we're hoping that ultimately over time these things will happen and people will come along. And generally that is what's happening. And I would say that there are conservative states that are doing a fantastic job with early childhood. And I go back to Alabama is, Georgia is. There are states that are doing wonderful things with early childhood that are not what most people would envision. So there is hope. But again, for those of you, it is, I see, I don't know, what state are you from? Well, there are... I used to live there. I know Wyoming fairly well. They're getting people to understand the science is the best hope we have. It really is. When Dr. Kuhl comes back to Washington, she's going to speak at the Race to the Top meeting this year. I've actually set it up for her to brief all of the leadership of HHS. And that, the assistant secretary, the deputy, all the top leadership are going to listen to her give the brain science. And not that we don't have support, but I figure it will cement what we need to get done. We're going to try and get her over to see some key people on the Hill for the same reason. But that's what I would say. I don't have any other handy-dandy answers for that one. Yeah.
Yes, Joan Craft from Arizona. I was wondering about all these efforts that you're making in early childhood. How have you connected with the K through 12 group? Has there been incremental movement or understanding or engagement around this?
I hardly move without the Department of Education at my side. Libby Doggett and I feel like we're joined at the hip sometimes. So yes, most of what we do, in fact, most of the policies that we put out are put out jointly by the Department of Ed and HHS. There still are, and I think that I'm not speaking out of school, I think the Department of Education knows this, that they have challenges in the K-3 system. And it gets back to what I just said. They have many teachers that have never had a class in child development. And that is a real problem in our public school system. And I think that's one of the things that we've been trying to talk about. And the report, the NAS, the IOM report says this. It's very clear about child development is the basis for everything. And it says it about leadership and principals. School principals. So where we've been able to turn around our principals on this issue, and I've visited a number of schools that they get it and they're doing it well. Is anyone here from Oklahoma? I had when I visited a school outside of Tulsa, I'm trying to remember the name of the school, the principal was lecturing me on family-style dining, and I thought, we have arrived. Here's a principal who knows this, and he's building a school that accommodates this, and I'm sitting there. So there's hope out there, but the key, like I was saying earlier, is getting the leadership of schools to understand this. The other thing, and we are writing it into a lot of what we do, and I think we're going to run out of time and not really get to take this on in the way I'd like to, is we're really working on transition policies. And I've told my grandchild's speech, haven't I here? Or maybe I haven't. But I had an experience which brought home to me why this is so important with my youngest grandson. And he was, so I'll tell the story. Some of you heard it again, I'm sorry. But he was, well, first of all, proud grandma. He's cute as a button, okay? He really is. But he's also the third child, spoiled rotten, knows exactly what he can do and not do. So he's in pre-K, the public pre-K program. They go to school in Maryland. And he's loving life, because I go to him, I'm nosy grandma, I go to visit, right? And so Alex is having fun. I mean, it's developmentally appropriate. It's a great environment. He's just loving life. So now he goes to kindergarten, okay? And so grandma that I am, I'm visiting. And he comes up to me, and the first thing he says to me is, Grammy, we do red light, yellow light, green light here. And he looks at me, he says, I've been yellow, but I'll never be red. I'm thinking about this, okay, well, what's going on? Well, Alex now has to sit at a table. His name is plastered on the table. He has to sit there. He has to ask permission to do stuff. And he's seeing fun stuff over there, and he wants to go over there, right? But all of a sudden now he's sitting here. He's got to do, it's a 180 from what he was used to, and he's not really liking it. So, but he'll go far enough, push far enough that he can be yellow, but he won't be red. I thought, okay, well, we didn't raise a dumb child. We just raised one that's, a little bit challenging. And so, but it made me think about, from a child's perspective, what is going on with these kids who go from our programs, which are developmentally appropriate with all of the activities and they're interested, to this rigid, sit there, now you're going to learn what I tell you you're going to learn, and you're going to go where I tell you to go. And it was like, wow, have we ever missed the boat? And the Maryland public schools are really good. I mean, they are. And he had a good kindergarten teacher, but he just could not function in that sort of restricted environment. He was pushing the limits all the time. And so, but I have really thought about that, and how do we really, really help? And I think we have given lip service to transitioning children between these systems. And so we do this little checklist. Do they know this? Do they do this? Sometimes we take a field trip to the school and we see it. That's a good one. But in most cases, they just, it's sort of like we're more interested in how the child is prepared to enter kindergarten than in the experience the child is going to have once he gets there. And I think we've got a lot of work to do on that in this country until we can get kindergartens to be developmentally appropriate, which they are not by and large. So, hope there's nobody in here from education. No. Other thoughts, comments? Back here.
Also, just, thinking of the transition, want to bring up after school, because, you do have those school supports for a child that might be pushing the limits or, needs extra help. And then they transition to an after-school program, when they might have had a one-on-one aid. Now they're like one-on-one other children. And I think there needs to be more support for that transition. There are expulsion issues in the borough of Kirkland, Maine, so in borough states it can be, the way they get their meal for the evening, so there's just more.
I think if we've had the conversation many, many times with the child care staff, and we've kind of, I have to say, if there's a place that I feel guilty about, it's that, you know, the CCDBG really goes up to age 13, and the school age issues are also very, very big in this country. I mean, I don't have to tell you guys that, you know, we have everything from taekwondo doing, you know, whatever they think they're doing, but, you know, all kinds of stuff out there. And, you know, we haven't had a lot of time to spend on it. One thing I do say, we are doing a TA center for after-school care this year. It will be part of our new TA system that is only focused on the after-school issues, trying to lift that up a little bit. But if there's a regret, it's that we just haven't had the time really to take that on, and we've been very focused on, you know, the pre-K time. And I get it, but, you know, time is time, and we're just really running out. Yeah.
Micah from Georgia, and we have looked at and love Early Educator Central. I mean, we think that it's such a valuable asset that's come out. Is there a way Registries can work with the administration to really look and see so that, you know, we can sit down and align some of that for our competencies, for some of the requirements on our registries where they have to show the competencies, and then we want to ensure the person taking the course is really who gets the credit, and to really have the opportunity to work so that we can ensure that our staff that are taking the time to go through that, our workforce, are getting credit in those registries.
Yeah, absolutely. That's a great idea. We should follow up on that one, because now that we're through the development of that whole system, you know, taking it to the next level, that would make a lot of sense. That's a great idea, and I'll make sure that we take that back. That's great, though. And George is doing really great stuff, too, by the way. That's a really good state for all of this. Other conversation thoughts, Roger? I absolutely do. Yep. I think it is, and I think it's finally getting what it deserves, the attention it deserves. And I think we finally arrived in this country in thinking that it is more than a work support, although it's an important work support, that it is not just one-dimensional. And I think people are finally getting that. So I think the quality issues are huge, and people are paying attention. So yes, I do. And I think the more that people in this room and other people ask people about the issue in childcare, but I don't know about you guys, but I have been I obviously work for the man, but I've been thrilled with President Obama's talking about childcare. And I think he's made it real for us. So I think it's been very important. Yep. Any other last thoughts? Don't give me any more tasks. We're done. No, we got enough to last us.
I will just say that the Alliance has taken some of the things I think that you said initially and incorporated them. We do have great standards and policies and practices where registries are collecting great information about the workforce. We have a line network, and through our most recent data pool, we compared the national survey with the Alliance data, and it's amazing at how consistent it is.
Really, that's good news.
We're real excited.
Is that somewhere where we can see it?
Yes, and in fact, we can send you the PowerPoint, but we will have the full report published by the end of this year. So we'll have it.
Oh, that's really great news, because that, you know, yes.
And it helps to validate our work and the reliability of the work and the information we're collecting. And I think that registries have done a great job with that, so I'm excited. And I'm excited about, too, the opportunity. You raised a question that I think that is one that we've all talked about, is who's in that space? Who's taking the leadership on the workforce? I think the registries are uniquely postured to be the leaders to take that step, and to be the leaders in their own states and their own communities on the workforce issue. They're close to it, they experience it, they have the data to show what's happening. We can do the trend analyses. Many states already do their workforce reports where we're showing the trends, showing what it looks like. So I think they're uniquely postured. So look for more, and look for us to be your partners in it.
Well, that's great, because I think that the next decade is going to be about the workforce. It is, and it's time. So and it's going to be about leadership. There's no question about it. So I would encourage you all to go back and think about that, and think about, as I started out, think about your role in this in your states, and how you can partner with people. Because it's just like childcare isn't a one-dimensional issue, neither is the workforce. And I think that that's where we've kind of gotten stuck. Either it's this, or it's that, or it's something else, but it's not that simple, and we're going to have to deal with that. So, well, as always, you guys, I really appreciate all the feedback. This is always a really good group to come and talk to, because get lots of good questions and lots of good thoughts, and keep on keeping on and doing the good work, because I think it's our time. When I look around Washington, and I say, one last thing, when I say to myself always is that there's a good news in being the hot topic. There's also a downside, is that it's crazy, but it is our time. And I think that if you all really feel that and go back and really take these workforce issues on, I think it is going to be the time that we make progress. If not, if we don't do it now, I don't see it coming around again for a long, long time. So thank you for all the work that you do, and thank you for having me, and go back and take it on. Thank you.